Good morning, Shoal Creek, and anybody else that may be watching out there this morning. We're going to do something just a little bit different. I am going to bring some information about the coronavirus and the situation that we're in just as a world today. It's just really important that we do take some time and make sure that we are educated about what's going on and we're doing the proper things that we can do to protect ourselves. I know you guys hear in the news every day how many cases are going up and how many people are being affected and at some cost dying from this virus. And it doesn't look like it's going anywhere anytime soon. So, we just want to make sure we take the opportunity and educate as much as we can about the coronavirus, things we can do to protect ourselves in this situation, to protect our families, especially as an African American community. Some reports are saying that African Americans are dying up to twice the rate of any other race. And that's really due to a whole host of circumstances, one of which, a small part of which sometimes is education and knowing what to do and knowing what prevention steps we can take. So we will talk just a little bit about that today, and hopefully you'll gain just a little bit of knowledge that you can take and do a wonderful job at protecting yourself and your family. So first, I'll give just a little bit of background on coronaviruses in general. And coronaviruses are actually not new. They've been around for decades. The first coronaviruses were actually discovered in the 1960s. And coronaviruses are basically a large family of viruses that tend to cause mild respiratory illnesses in humans. Something like the common cold is actually a coronavirus. It's caused by a coronavirus, but we've just never heard it, until now. We've never heard the association. So coronaviruses are actually very common. It's a lot of them. But over the last few decades, there have been strains of coronaviruses that have come along that has really caused some more severe illness in humans. If you remember the SARS outbreak, SARS was all the hype for a while there around 2002. SARS was the severe acute respiratory syndrome. That outbreak was actually caused by a coronavirus as well. So now here in 2019, 2020, we're seeing a new strain of a coronavirus that is kind of one of those more severe strains as well, that's causing some severe illness and death in humans. And so they have called that disease COVID-19. COVID-19, basically coronavirus disease 19 is where the name was coined. But it's a newly identified strain of a coronavirus that's been identified to cause all the illness now. So in order to understand how to protect yourselves best, it's important to understand how the virus is spread. So we'll talk a little bit now about how the virus is actually spread. And so understand just some background that when it comes to, viruses and the transmission of different diseases or viruses, some stuff is very contagious, meaning it does not take a lot of contact at all to pick it up. And some things are not as contagious. So it's something that you may have to have a lot of exposure or prolonged or repeated exposure to something to be able to become ill from it. So on that spectrum, coronaviruses actually fall at the very end of being very contagious. There's some information suggesting now that people are getting COVID-19 easier than they get the flu every year. So it's a very, very contagious, or it spreads very, very easily between people. And it's also believed that the most common form of transmission for COVID-19 is person-to-person contact. So in general, the closer you interact with somebody and the longer that interaction is, the more likely you are to be infected if that person is infected from the virus. So that's where the whole 6 feet, I know everybody's probably tired of hearing about 6 feet distance, but that's where that comes into play, because it's believed that if you're at least 6 feet away from someone, you will not get a lot of the respiratory droplets that come out. So as we talk, and even as I'm talking now, there's not any visible big droplets maybe coming out of my mouth, but if we talk or laugh or sing, or there's these respiratory droplets that come out naturally. And if I'm a person infected with the coronavirus, or with COVID-19, within those droplets are the virus particles that will get the next person sick. So if you're at least 6 feet away from somebody, it's less likely that those droplets will reach you, and they could be inhaled. They could actually land in your mouth or wherever. So the more distance you keep between yourself and other people, the less likely you are to get those respiratory droplets, possibly contacted. It's important to remember, though, that COVID-19 does not always necessarily cause symptoms right away. So people may be infected with COVID-19 and asymptomatic or not showing symptoms of illness. And they're actually very infectious the 2 days before they become ill. So if I'm feeling fine and, nothing's really wrong, I may go to the grocery store or go do my normal thing. I'll go to work and do all my normal tasks. All the while I'm shedding virus and infecting and possibly infecting all those people that I come in contact with. So the person-to-person contact is the biggest method of transmission that they believe. Now, there's also a second method that they think is not as common, but definitely still possible, and that's the transfer of the virus on surfaces. So they really don't know how long the virus lives on surfaces. Some reports say it can be from anywhere from a few minutes to a few hours. And when I say on surfaces, I mean, for instance, if you go to the grocery store and you touch the counter at the checkout and you're infected with the virus, well, the person that comes behind you, when they sit their stuff on the counter and touch that, then they're picking virus particles up on their hands. And if they naturally scratch their nose or rub their eyes or anything, then that's how they just introduce the virus to their body. So picking it up on surfaces is also a common way to spread the virus. So with that said, it's important to understand that part for, knowing how to take the steps to prevent it as well. So you can do several things to protect yourself now that we kind of understand how the virus is spread. The first thing is, one of the main things is keeping that good social distance between yourself and other people. That in itself, just putting physical distance between yourself and other people's respiratory droplets as they talk and laugh and all that we just discussed, will provide some protection for you. 6 feet is about 2 arms lengths that you want to just make sure you always keep at least that distance. If you're like me, I'm like, no, give me 10 feet, but at least 6 feet between you and other people. The second thing is washing your hands. The importance of that cannot be said enough. I mean, just in general, not just for the coronavirus, but for all types of things you can prevent exposing yourself to just by washing your hands. You want soap and water for at least 20 seconds when at all possible to thoroughly wash your hands. If that's not an option, using a hand sanitizer that contains at least 60% alcohol is definitely a second best option to washing your hands. And if you're ever in a situation where you cannot wash your hands and you've been out in public, you may have been touching this or that you're really not familiar with, always try to remember not to put your hands to your face if your hands are not washed. You know, if you don't have hand sanitizer, you haven't washed your hands, just be very conscious of touching your face, of scratching your nose, of rubbing your eyes, or putting your hands really anywhere near your face or your mouth. That is very, very important to remember too. And also, you want to make sure you're routinely disinfecting surfaces that are frequently touched. So, you know, whether that's at home, you know, sometimes at home we sometimes have guests come in and out, you know, family, children, anybody that's coming to visit may come in and out. And so you still want to make sure that you're routinely cleaning and disinfecting surfaces, doorknobs, countertops, things like that, just to minimize the transfer of any viruses that are present. Definitely, if you have a workspace, a public workspace, a desk, or even if you work in a service position, you know, cleaning those countertops. We see a lot of stores now cleaning the keypad, the debit keypad, cleaning pins in between customers. And I also see a lot of stores not doing that too. So just be very, very careful and very conscious of people doing that. It's always a great idea to carry your own pen these days, so you don't have to use the pens there at counters when you're paying for your purchases. But just be very mindful of cleaning those surfaces. And the last thing is covering your mouth and your nose with a mask when you're around others. So I will say a common misconception for the mask is that the mask is going to protect you from your environment, when it's actually the opposite. The mask is intended to protect others from you. So if I'm an asymptomatic person that has been infected with the coronavirus, but I'm not showing symptoms, so I don't even really know I'm sick yet, and I'm going around in public doing my normal thing, if I'm wearing a mask, all those respiratory droplets that we've talked about, the mask will hold that in as much as possible to prevent it from getting to other people. So if you're wearing your mask in conjunction to spacing yourself apart, then that's a very much a lower risk situation that you'll be in. So the mask, like I said, the mask is to protect you, to protect other people from you, not necessarily to protect you from other people, even though it does provide some level of protection from what you're taking in, unless it's some kind of really like a filtration system like they wear, like healthcare workers wear. The mask isn't really protecting you from the environment. It's protecting other people from possibly virus that you possibly are shedding. So it's really important if everyone could comply. I know the mask is like a hot debate. You know, they have people that are for it, they have people that are against it. But if the majority of people were to wear a face covering in public and reduce the amount of virus that's transferred to other people, we would be in a lot better place than we're in right now, as far as our numbers, our cases and our deaths are going. So very important. And the mask is not a replacement for social distancing. So you don't want to, just because you have a mask on, you don't want to have people kind of all in your bubble. You want to do both. You want to make sure you're socially distancing yourself from people while also wearing the mask too. So it's important to keep in mind who is really being affected the most by the coronavirus or by COVID-19. And what we know pretty much as a fact is that the older population is more at risk, and your risk kind of increases with age. So, you know, if you're 50, you're more at risk than a 40-year-old. If you're 60, you're more at risk than a 50-year-old, and so on. Your risk really just increases with age, and the most vulnerable population are folks that are 85 years or older, have been placed in the highest risk category. And also people with pre-existing conditions have a much higher risk of getting and dying from COVID-19. And so we kind of mentioned how African Americans are seeing a much greater burden of disease and death than any other race. And like I said, that's due to a whole host of different things. But one thing that lines up is that as African Americans, we have a very, very high rate of pre-existing condition. You know, unfortunately, within our communities, we see a lot of diabetes and heart disease and obesity and cancer and all that. And all those are definitely things that make us more susceptible to getting COVID-19 and dying from COVID-19. So it's very important to remember that when you're thinking about risk and protecting yourself, and if you're somebody that really has pre-existing conditions, or if you're somebody that's a part of that older population, you really want to really take those extra steps to protect yourself and to not put yourself in situations where it could be harmful, or it could be more risk for you to get COVID-19. For most people, what you want to do is do things like monitoring your health daily. You want to be alert to your body for signs and symptoms. You want to watch for anything that's on that symptoms list for COVID-19, things like fever or chills, cough, shortness of breath, difficulty breathing, any of those kind of respiratory symptoms. There's been a lot of reports of fatigue, a lot of reports for this new one, which is just a loss of taste or smell. Some people are reporting with no other symptoms. They just lose their sense of taste or smell. Of course, sore throat, runny nose, any of those cold or flu-like symptoms could be onset of COVID-19. But then there's also these really interesting symptoms that people are reporting of gastro issues, of GI issues, so nausea, vomiting, diarrhea, kind of things. You know, I've known people that GI symptoms were the only symptoms they had. They never had the fever or the sore throat, the typical symptoms. They just had the gastro symptoms. So it can really present itself in any way in different people. And then, of course, there's those people that have it and their symptoms are so mild that they don't even really know they're sick. So again, that's that asymptomatic person that is carrying the virus, and they, you know, you can be asymptomatic to the point of you haven't shown symptoms yet. So you're infected with the virus maybe 2 to 14 days before you actually show symptoms. So you could be asymptomatic for 2 to 14 days before you show symptoms, or you could actually be asymptomatic the whole time, because there has been cases where people test positive for the coronavirus and for COVID-19, and literally have not felt any different. They feel normal. So it's a very peculiar little thing. So it's very important for you just to be alert of your body, be alert of any signs and symptoms or changes that you may notice. Take your temperature if symptoms develop. That's probably one of the first things you want to do, is just take your temperature and see what it is. And then following guidance. If you have a primary care doctor and you start to feel ill, you want to make sure you contact your primary care doctor. Stay home. Don't go to the office. They'll usually instruct you to stay home, or maybe go through a drive-through testing facility, or they'll schedule you an appointment to come into the clinic. But that will be your first bet. If you don't have a primary care doctor, there are so much has been changing about the testing now. Now they have really opened testing up to almost anybody that needs it or feels they need it, with some of the drive-in centers. So it just really depends. What I'm going to do is, at the end of this video, I'm going to put up my phone number, and I want, if somebody needs to call me, if you have any questions about testing here in Cleveland County, where to go, or how to get connected for care, or for just any information that you need, I'll make sure I post my number at the end of this video, and you guys can definitely give me a call. I'd be happy to help you get connected to whatever other services that you'll need. So I do also want to point out to keep in mind to be mindful of emergency signs and symptoms. So some of the stuff that we've already named, yeah, sure, if you get a call for a sore throat, stay home. But if you start to notice persistent pain in your chest, discoloration of your lips, confusion, or the inability to stay awake, you're constantly falling asleep, something like that, those are emergency symptoms that you should go to you should seek emergency care for that. You should go to the emergency room or wherever you can get to that has some emergency services for symptoms like that if they're more serious. I also want to acknowledge that I know quarantining has been hard. I know staying home and being isolated has been hard. It's hard on people for many different reasons. You know, it's hard on me because I haven't had a break from my kids in like 3 months. But it's actually harder on some people because they don't have anybody there with them. So there has been this surge in mental health issues that are occurring due to COVID-19, and not necessarily due to the actual virus, but due to the conditions that society has caused us to have to undertake now because of the virus. So I also want to acknowledge and to point out that if anybody themselves or they feel they have a loved one that is experiencing any type of mental health crisis or mental health condition, I mean, anxiety and depression sometimes is through the roof, especially for our loved ones in the congregate housing facilities that really have been on lockdown for months. I know I have an aunt in an assisted living facility who's absolutely miserable because she literally sits in her room day in and day out. So those are some real issues that our loved ones or that ourselves, you know, are dealing with. And so I want to make sure, again, I'm going to post my number at the end of this video. If anybody you know or if you yourself really needs help in that area, please feel free to reach out, because there are lots of services that we can get people plugged into and get people connected to kind of help combat some of the mental drain and the mental health issues that are really being perpetuated by COVID-19. So I absolutely welcome you guys to contact me about that. I feel like I've said a lot, but I'm not sure that I even covered everything. So if you have any more questions about the coronavirus or COVID-19 or anything, please feel free to reach out to me. I would love to get you more information. I don't know everything, but I could find an answer to almost anything. So I welcome that. And I know we all miss the fellowship of each other. I wish I am praying for the day that we can all get together again in the same room and love on each other like we've always done. And so I know that day will come. I want you guys to stay encouraged. I want you guys to just, you know, keep the faith, keep hope alive that we will get to a better day. This too shall pass. And thank you for this opportunity just to get you some information. Again, my number is going to be on the screen. If you need anything else or have any other questions, feel free to give me a call. So take care and God bless you guys. Good morning.